So I'm Michelle Ross. I'm the founder of CliniQ, which is a sexual health and wellbeing service for trans people, and we're based at 56 Dean Street. You've all heard of 56 Dean Street. I'm also a psychotherapist, and I've been involved with HIV for 30 years. And for this session, I'm going to say I'm a trans woman.
Hi, I'm Kate Nambiar. I'm a sexual health doctor from Brighton. Around about just a little bit after CliniQ started, we started a similar service in Brighton, which is our sexual health service for trans and gender diverse people. And I am also a trans woman. And I think that's really, really important to say. It's important for me to own that. It's important for me to say that, because I think it's important for us when we're talking about reaching the trans community or trans communities, that we're speaking not as healthcare professionals to the community, but we're speaking from the community. And I think that for both of us, being trans people, working with other trans people has been transformative in bringing sexual health, bringing the message about PrEP, bringing the message about HIV prevention to that wider audience. I'm just going to start off by just setting the context for why it's important to be talking about PrEP in trans people. Oops. We just heard from the previous speakers about the high prevalence of HIV in trans populations. This headline figure is often quoted. It's from a meta-analysis of several studies throughout the world, particularly in trans women. And we find that this is astonishingly high prevalence, 19%. And if I just set that in context, generally worldwide, averaged out, the HIV prevalence for men who have sex with men is probably around about 14%. And for female sex workers, around about 12%. So what we're showing here is that being a trans woman, particularly a trans woman who has sex with men, is the highest risk factor for HIV acquisition on a worldwide basis. We've also showed that trans women are, the odds of being HIV positive are 49 times greater for trans women than any other population. It's important we don't forget to think about what's happening with trans men, and sadly there's very little evidence out there. What we do see is that there's a low prevalence, but I think, and as I'll show later, that this may well be a significant underestimate. Now, what I also want to show you is that there's significant geographic variation. And particularly in Europe, the study that I've been quoting just looks at 3 European countries, 3 studies in 3 European countries. And I'll just bring up the map here. So we can see a study that's contributed from the Netherlands here, just under 19% prevalence. In Spain, 18% prevalence, and in Italy, nearly 25.5% prevalence. So huge prevalences here in Europe. But I think what's really key about this figure is the areas that aren't covered. We can see other areas around the globe that have particularly high risks of HIV. India, countries in South America. But there's massive gaps throughout Eastern Europe. We have no information about the entirety of Africa. And that's something that we talked about earlier this morning about involving populations in research. This is something we have to do. Not only is HIV more prevalent in trans people, particularly trans women, I just want to show you something about what it does to us as a population. And this is a study looking at mortality in trans people. For those of you that aren't used to looking at plots like this is a survival plot, a Kaplan-Meier plot. And on the y-axis going up is the proportion of people that are surviving. So, and on the x-axis, the time of follow-up. So this is a study looking at people who have been followed up for 30 years after transition. So if you imagine that everybody survived for 30 years, the line would be flat right across the top. And so what happens is that over a period of time, people die, and that's what we expect. So this study looked at comparing trans people to age-matched population controls. So if you're a cisgender woman, by the time you get to 30 years, about 95% of people are surviving, just under 90% for cisgender men, but around about 75% of trans people are alive. That's a statistically significant difference. We are dying sooner than other cisgendered people. And what is causing us to die? I'm going to just show you another study. This is from a study done here in the Netherlands, a large study of just over, 1,300 trans people. And this study is often quoted when we're talking about hormone therapy because it was really sort of focused on cardiovascular deaths from a particular type of hormone. But one thing that it did, which was really interesting and really useful, was to look at other causes of mortality. These figures are standardized mortality rates, comparing the risk of you dying compared to someone else in the general population. For a trans woman, you are 30 times more likely to die of HIV or AIDS than someone in the population. There weren't any cases seen in trans men. The other issue, which is actually really key as well, are that deaths from illicit drug use and from suicide were significantly greater. So if there's one thing you can do to improve the outcome and the lives of trans people, is to make an effort to improve and to advocate for our sexual health and for HIV prevention, and to advocate for our mental health. I just put that out there because that is probably the sort of thing I want to get across. This is why it's important. This is why we're talking about PrEP for trans people, because it's not only more prevalent in us, it's killing us as well. I'm going to hand over to Michelle just to talk about how we can make a difference. It's all very well seeing all these figures, but how can we practically change this?
Thank you. Thanks, Kate. I'm going to stay sitting down. You see these here. This is 32 women, trans women, who identified as HIV positive, with an age range of about 33. And a number of them transferred their care to CliniQ at 5016 Street because of the extra support services led by trans people, accessing community advocacy and peer support, as well as counselling of a wide range of issues. And you'll see, I'll just go through some of these. The demographics, what the number is 70%, is it 70 what? From the BAME communities. And that is reflective of worldwide findings, really, that trans women, the majority of trans women living with HIV are from the BAME communities. It's black and minority ethnic people. Non-white. Okay, so non-white, as Mark said. People of colour. Does that help? Yeah, okay. And that's findings from around the world. And as we all know, trans people are key populations in HIV. It wasn't always the case because trans people were excluded. So can you do the next one? Okay. So, has that skipped a slide? No, there. So the conclusion is trans people face significant barriers to healthcare. All healthcare, not just HIV. Poor rates of viral suppression, poor adherence to treatment, combined with high-risk behaviours, pose a significant risk of onward transmission. To improve outcome for trans living with HIV, health services must have an intersectional, trans-competent approach to care continuum and able to manage risk factors. And that's really important because what's relevant for trans people who are often excluded from health services is to be aware of what your health needs are and to be able to ask for those as well. So at CliniQ, we've, for the past 18 months, we've been doing outreach testing at sex on premises places where trans women have sex with cis men. And within the afternoon, at least 200 to 300 people go to that place. And it's in central London, and we do testing. And we're in the process of doing the testing. We talk to people. We talk to people about PEP, and we talk to people about PrEP. And there's a real lack of awareness within that. So as you can see here, the tests we've been doing are the point of care test, third generation. And so should we just go to the next slide? So this is the findings, really. So 97% of male identified as male at birth, and just over 2% are female at birth. Gender identity and sexual partners are cis women, 53%, cis men, 63%, trans women, 59%, and trans men, 5.3%, and non-binary, 5%. And as you can see here, these are the identities that we found at the clinic, at the Sets on Premises place, that female, including trans women, and this is not usually said here, but at this Sets on Premises, this is how people self-identified as male, including trans women. So what it is there, so some people dress for sex there and might not be able to be out about their identity in any other place. So when they're there, they identify as women, but in their general life, they identify as male. Okay, so genderqueer and non-binary is only a small percent, and other people, there's a range of people that don't identify with those genders. They identify as non-binary. So 53% of people had unprotected intercourse within the last 6 months. 15% had never tested for HIV. 25% had not tested within the last 3 to 10 years. So, as I said, we talk about PEP and PrEP because within the trans communities, PrEP, there's not that much of awareness of PEP. And as you can see here, 68% of people had not heard of PEP. 78% of people did not know where to access PEP. 83% of people had not heard of PrEP, and those that had, I'd heard about it in the media, especially in the UK. So 68% did not know where to access PrEP. And as you say here, and this is one of the areas that has a concern for some trans people, that 78% of people would not take PrEP if it was available because they were concerned about the reliability, concerned about any interactions with hormones, and hormones are not just about physical changes. There's a psychological connection and emotional connection to hormones that we take as trans people. Well, that's for the trans people that do take hormones, not all trans people do. And it's really strong, and some people would rather not take HIV medication, not just PEP or PrEP, than have it affect any part of the hormones. So a significant lack of awareness concerning safer sex, PEP and PrEP. Perceived lack of acceptability concerning PrEP, despite well documented. But the thing is, the evidence had not reached most of the trans people. So we were starting really raising people's awareness on a very basic level. It highlights the need for regular visibility of trans and non-binary people in research and campaigns and in service delivery.
Thanks, Michelle. So I just want to talk briefly about the experiences of both our clinics in England. So some of you will be very well aware of the impact study that is going on in England. Parts of the UK already have PrEP rollouts, so in Wales and in Scotland, but in England that's not yet the case. What is happening is that there's a large clinical trial ongoing, and this is an opportunity for us to be enrolling trans people within the study, and both our clinics have been working very hard since the study opened very recently to recruit and enrol people. So far, to date, at CliniQ, 27 trans people have been recruited to the impact study through 56 Dean Street. Many of those now are having to be referred out to other clinics just because of capacity there. At my service in Brighton at Clinic T, so far we have referred in 11 people. We're still waiting for 3 to be screened at the moment. 7 are on study. Quite interesting, and I'll talk about this in a second. One person, one trans man, failed screening. He'd already seroconverted by the time he had come for his screening appointment. And it's sad to be in that situation where we are seeing people who are attending regularly, who are aware of PrEP, who are waiting to go on to study, but miss the opportunity, and in his case, just by a matter of months. We found that for the people who we're discussing this with, that PrEP has been acceptable, and in fact, people are really wanting to go on to study. But there's still a large proportion of people who aren't aware of PrEP, and who aren't, just as Michelle was saying, who aren't feeling that they are particularly at risk of HIV. It's quite interesting. Yesterday, I was at a meeting at Public Health England, and we're doing a study into reproductive health in trans people. And one of the figures, we were looking at lots of other things, and one of the figures that we were looking at in the preliminary data was the number of people who had an HIV test. So this is 470 people that we studied. 81% of those people had never had an HIV test. That's before we even start talking about PrEP. There's people who feel that then HIV is not relevant for them. And so it feels almost like there's this mountain to climb to reach many of our population. Yeah.
Just to clarify something. 27 people at CliniQ for 16th Street, trans people, and that's due to the limitation of the trial. We could have had a lot more than that, really, but it got filled up really quickly. The numbers that we could have allowed to have, and so yeah. Was it you okay? All right, okay. Should we just go to the next slide? Okay, yeah. This is about concerns that. So this slide here says hormones and PrEP, being informed, knowing your stuff, and who. I'm talking to you. So you be informed about if you're speaking to trans people and they express any concerns about taking PrEP or PEP and the interactions with hormones. This isn't that clear, but you've got the link there and you'll get these slides as well. And so there's no contraindications between PrEP and hormones. There's been research on that, and this is the latest research from Liverpool, and it's really important that people are informed of those. And not only you're informed, that you inform the people, the trans people that you're seeing, so that they feel fully informed and secure in that there's no interactions. Okay. Oh yeah, it's me. PrEP Interact Trial, 2 centres. So this is just a breakdown of some of the 27 people at CliniQ. So it's 1 trans male on event-based, 4 trans males on daily, and as you can see, 8 trans women on daily, 1 assigned female at birth on daily, and 1 male assigned male at birth, event-based, and 1 cis male with a partner who's trans. 11 unknown at this page, but I didn't think we needed to break down it all. So, Kate.
So similarly for CliniQ, I think I won't necessarily go through the details, but I think one key thing to point out from our experience of recruiting people and actually getting the word out was that we see a large number of trans men in our clinic service. And that, I think, is particularly key. There's more and more trans men that are coming and seeing me and saying that they are feeling empowered to be part of the gay male community, having sex with other men. For guys who are in that situation, the discussions around their sexual health, around HIV prevention and around PrEP start to become more and more important. And we have been working very closely with a group within Brighton to really sort of push and to get the word out there, really from the grassroots. And I think that has just helped us to be able to get people onto study and get people who are coming to us and saying we want to go onto the study. And as I said earlier, it just highlights the fact that we've seen one trans man who has seroconverted. But this isn't just a theoretical risk. This isn't just something that we think, oh, this could happen. No, this is actually happening, and we have to do something about that.
Gosh, you come forward. Have I got to rush? Oh, well, you just have to give me a few minutes. Okay, all right. Just to pick up on Kate's comment about trans men, we do see a lot of trans men at CliniQ and at Clinic T, and so at this meeting, I'm not sure who's trans male identified or whether anybody wants to self-disclose that, but often they are a voice left out, but certainly not at CliniQ. Gus, can you play the slide? Let's. I think you just don't give it. I'll go to the next slide and press what? Shut it. Hello.
My name is Aidan Walton. I'm a director of CliniQ and I'm a health advisor at 5016 Street. So my experiences as a health advisor talking to trans guys and trans masculine people about PrEP generally is based around a lot of information giving. I think there's a definite lack of awareness of PrEP and the benefits of PrEP within the trans communities that we see at 56 and at CliniQ. So in terms of the concerns that we might see within our patient cohorts, they're often not concerns that maybe match up with the concerns that we have as clinicians. So for instance, there are issues around vaginal atrophy and people taking testosterone, where we have clinical question marks around what that might mean for PrEP efficacy. But the concerns that we have within the communities tend to be more focused on things that we as clinicians aren't concerned about, so interactions with hormones and whether taking PrEP will have negative impacts on the effect of people's hormone therapy.
Oh, that was it. Okay. Oh, great. I'll try and do this. Okay. So we've mentioned barriers earlier in our small groups, and so reducing the barriers is something that we're constantly working on around sexual health and PrEP, especially at the moment. And we produce a lot of images and resources. So this is one of our resources where we talk about, are you prepared? That was a report for WHO we did at CliniQ 3 years ago. So we have been looking at PrEP and for some time now. And I am told I'm going to hurry, but I'm not going to hurry. And so, I just thought, activism is not just about out there, it's in here as well, and alive and kicking. So, here, you can see this. Oh, really? Okay. So what's really important is not just to have images of trans people and put test or here's PrEP. So it's about information. It's about why this image is relevant to you. So that's one of our images. And where's that clicker gone? Over there. Oh, gosh, wait a minute. It's that way. This always messes up when I do this. Oh, there you go. Okay. So sex and trans people, yes, we do have sex and lots of it, some of us. But so we produce these two booklets. And these. And all we asked for is the posting. We've got lots of them. And we brought some here for you to have a look at. And so it's really important as well that sex can be hot for trans people and it can be safe. It can be condomless with PrEP. Right? And we want to make sure that it reaches trans people, not only in the UK, but right over Europe. And we'd love to work with people who want to do that. So if you can... Oh, God, I keep leaving it to you, Kate. Sorry. Okay, so what about this? Well, my dear Gus, where is he? Hello. This is on NAM website as well. So if trans people are high, as it says here, who are trans people acquiring HIV from? Well, some of us have sex with other trans women, but the majority of us have sex with cis men, and that's where the acquisition is from. So that hidden population. So those cis men are HIV positive. How are we reaching them around testing? How are we reaching them around PrEP? We're not. Because the cis men that I've spoken to at these sex on premises places are not even interested after that. They know nothing about PrEP. They do get tested, though. Quite a lot of them have been tested. And so this is really important. So when we talk about hidden populations, this is an hidden population for sure. And PrEP outside of Europe, do you want to say something about this? Oh, okay, then. PrEP outside of Europe, there's some places, so this is Callan Lord in New York, and they throw PrEP at trans people. They're really great. Okay. But no, it's really important. Oh, did you want to say something? Okay. And in Bangkok and around and in Australia, PrEPs are being done. And here, this is from, all right, I'm really rushing now, honestly. And this is important. So PrEP, the Tangerine Clinic in Bangkok, and I know Will went there, met someone from there recently. They sent me these figures because I asked them to. So they're doing quite a lot of work in Bangkok on PrEP and PEP, but it's not free. But they're trying to find a way to deliver it to people with really low income. PrEP, there's 62 trans women on PrEP and 85 receiving PEP. I don't know the figures for trans men, even there. So I'm hurrying. So go on. Yeah, you do it.
Okay, we're just going to finish just to go through some of the sort of key points that we believe are really vital towards engaging trans people within a framework for making PrEP available. The key one really is just to involve us. If you don't talk to us, you don't involve us in these things, then you're really, you're just there's words going out into the wind. It's vital. It's not just about consulting and talking to people. Like I said at the beginning, it's about speaking from the community, getting community people, getting people who are trans and non-binary involved within any of these programs that you have for PrEP delivery and for advocacy. The needs have to be tailored to the local population. What will work for my population in Brighton will be different to what works in London, will be different to what works out in other countries in Europe and other parts of the world. There are a number of organisations, support groups, social media, all of these things we can access, but we need all of these things to be culturally appropriate and sensitive to the population. And I think the really key thing is to be talking about doing stuff with trans people and not for trans people. Let's call it there. Thank you all very much.